Trinidad and Tobago has recorded its youngest COVID-19 fatality. Ministry of Health officials have confirmed the person was under the age of 25. Confirmation came during the Ministry of Health's virtual press conference on Wednesday. Khrystal Wilson has more.
No one is immune from the morbidity of COVID-19. This from Ministry of Health's Principal Medical Officer of Institutions, Dr. Mariam Richards, during Wednesday's COVID-19 virtual update, who confirmed this country has recorded its youngest COVID-19 victim. According to Dr. Richards, for confidentiality reasons, she was unable to share certain details, but noted the person did have underlying health conditions.
This has been the youngest death from COVID-19, and while I am unable to give you the accurate age of the patient in the interest of patient confidentiality, I would like to remind the public that no age group is immune from the morbidity or illness, as well as the death or mortality from COVID-19.
Dr. Richards called on members of the public to remain vigilant to protect themselves from contracting the virus.
It is important to note that our last death, which was reported between the last media conference and this morning, occurred in a person who was under 25 years of age. While this was an exceptional situation and circumstance, and the person had pre-existing medical conditions, this is a warning sign to our population that COVID-19 strikes all persons.
Dr. Richards, in reiterating that it was still necessary to remain vigilant to avoid contracting the virus, also called for people to limit socializing.
Let us avoid parties and get-togethers at this point in time. Remember, even if you are healthy and you think you do not have pre-existing medical conditions, you will be exposed and expose your close family members and friends who may have coexisting medical conditions.
People are advised to maintain hand washing and social distancing at home, especially where there are elderly persons. Khrystal Wilson, TTT News.
Another COVID-19 related death has been reported. The death toll now stands at 107. The Ministry of Health says the patient was an elderly male with pre-existing medical conditions. In the last 24 hours, 26 additional persons have tested positive for COVID-19 and 5 persons have been discharged from public health facilities. There have also been 55 recovered community cases. This brings the total number of active COVID-19 cases to 1,241. That's 35 less than yesterday. Since the first case was reported on March 12th, there have been 5,594 confirmed cases of COVID-19 reported in Trinidad and Tobago. The Ministry of Health is advising people who share living spaces with the elderly to upkeep COVID-19 health protocols in an effort to protect elderly people from contracting the virus. Healthcare practitioner nurse Fatality Gomez says those who live with senior citizens are likely to leave the home daily should develop a routine for their return.
Anybody who is leaving the home on a regular basis on the return home must first remove shoes before entering the home. They should practice hand hygiene, such as hand washing with soap and water for a minimum of 20 seconds. They should sanitize surfaces that they would have touched, such as the doorknobs, such as the light switches, and continue sanitizing surfaces in the home, such as the table, the countertops, the bathrooms, the faucets. These are things that you can do in the home.
Nurse Fatality Gomez also says elderly people should limit leaving the home unnecessarily.
If you have elderly persons at home, they should not be the one exiting the home to run regular errands. These errands, such as going to the groceries, going to the market, should be done by persons who are at lower risk.